Thank you. I'm presenting this on part of one of our internal medicine residents who did this project with us as part of her residency training. I have no affiliations to disclose. So, as we've heard, fecal and urinary incontinence are commonly managed with containment products, and we have very little idea about what constitutes acceptable wait times in soil products. And that may vary, of course, depending on pad type and acceptability. And with a drive to accept a more patient-centred culture, we wanted to get an idea about patient preference and wanted to establish views on wait times for urine and feces soiled products in elderly inpatients. This was a cross-sectional survey. We needed a robust estimate, we needed a sample size of 29 inpatients to get a robust estimate of the urinary factor, and we elected to talk to 50 inpatients and 50 direct care providers on their views on time spent in soiled products. We categorised waiting times to allow us to develop a tolerability score, which we felt would be quite a useful way of looking at this, and define tolerance based upon the median scores of acceptable waiting times. So patients were asked what would be an acceptable waiting time to spend in a soiled product with urine by night and day and feces by night and day, and those questions were also posed to their caregivers, and then an estimate of true waiting time was gathered. So the patients' mean age was 79, the majority were female, the minority were wholly continent and had continence at some point. Half of them used gait aids, and 20% were nursing home residents. Our care providers were mostly registered nurses and had been working on the unit in which the patient was located for 5 years or fewer. So these are our results. You can see that for patients, they were more tolerant of waiting in soiled product by urine by night than day, but for both acceptability estimates were statistically significantly different from those of their care providers. Both care providers and hospital inpatients were equally intolerant of spending time in feces soiled pads. The actual waiting times were much longer by day for the patients, and were within the limit of acceptability by night. Factors which influenced tolerance were prior use of pads, use of walking aids, and nursing home residence, something about maybe the normalisation and institutionalisation of those individuals. For the care providers, neither duration of working on the unit nor level of training had any impact on their views. So we found significant gaps in patient and provider perspectives with respect to acceptable wait times, particularly for daytime incontinence, and markers of institution and healthcare exposure influence tolerance to soiling. We felt that it's actually important to ask the patient about what they think, and certainly in these days of patient-centred care, that seems to be a given. But there's still a considerable need for education on containment and the importance of establishing patient preferences for care. Thank you. And funding was by this organisation, that's me.
Märta Lauritsen from Sweden. What do you mean with a soiled absorbent product for urine? Is it leaking beside, or is it just that it's urine within?
Actually, either wet or soiled by feces. We gave no idea of the concept of leaking or reaching maximum absorptive capacity.
Thank you.
Hi, Panayota Reiter from Denmark. I wanted to ask, what is the next step? What are you going to do after this study?
Well, that's an interesting point, and I haven't actually lent much thought to that. And I think it would certainly the tolerance thing. There's a lot of debate around nighttime care, and I think that we certainly want to venture into nighttime care, particularly in our institutions, where there's a debate around regular changing versus sleep quality, and certainly Donna Bliss has published some interesting work about institutionalized individuals becoming more tolerant, but therefore a greater risk of developing complications of inappropriate product usage over time. So I think there's a couple of angles there that we might like to look at. And if I've given it away, we can collaborate. Thank you.
Hello, Alison Bartley from Coventry University. I'm just interested because obviously this lends itself then to staffing levels. So we have a big debate in the UK about not only staffing levels and how many patients per, or and the members of staff can look after, but also the levels of training of those staff. So how many registered nurses versus how many healthcare assistants you need on a unit. So yes, we need to understand patient acceptability, but how actually practical is that in practice? And can we then send to managers, well, actually, this is what's acceptable, this is what patients find acceptable, this is what you need to staff the wards, because you can't manage that if you don't do it, if you don't staff them appropriately. Does that make sense?
Yes, and I understand that the UK NHS suppressed its nurse staffing report because it couldn't deliver quality of care. But I think, again, it's another point of argument. But likewise, it's not just a provide more staff, it's an education awareness and are we doing the right thing at the right time, as much as asking for more resources.
It would be interesting to look at the community as well, though, because we used to, obviously, I used to work in the community, and we used to get social services ringing us and saying, well, actually, you need to provide a more absorbent product because we can't get in to look after these patients. And I would imagine that out in the community, that's even less acceptable than it is in the hospital, because you're going to be sitting there for hours, potentially.
Yep, right. Yep, I don't disagree.
A short, does this...
I think the man's moving to turn it on.
This one worked. Claes Hultling, Karolinska Institutet, Stockholm. I would just like to give you credit for a great approach and a great study to start with, because exactly this is what we're looking for, some kind of empowerment, to have the patients to recognize their needs and their priorities. So my message to you is, why don't you go to the industry? They will find a chip and an app for your telephone. So when the diapers are wet enough or enough feces, it will indicate, and the nurses' stations will run immediately, and the quality of life for the patients will increase dramatically.
Yeah, and on that note, there are things in development now which do send an SMS message to the caregiver when appropriately wet. The problem is poo. The sensors can't detect poo, and we need to think about that much more carefully.
Well, that's a challenge. Soon they might.
Yes. Thank you.
Good. Good. Thank you.
Thank you.
Thank you.